whatever happened to predictability? The milkman, the paper boy, evening TV. You miss your old familiar friends, but waiting just around the bend. Everywhere you look, there's a heart, a hand to hold on to. Everywhere you look, there's a looks of somebody who needs you. When you're lost out there and you're all alone, life is waiting to carry you home. Everywhere you look, everywhere you look.
Hey, are you getting my guy in 37, Catherine?
Yeah.
Oh, okay, good. Oh my gosh, how many other patients do you have?
I think they gave me 6 other patients tonight.
Oh my gosh, that's a lot. We had a kind of a busy night, so hopefully you get a lot of good help. Anyways, I'll go ahead and give you a report on this patient, this guy. His name is Vincent Marcello. He is a 58-year-old male. He's in with COPD. He's been having, and he's also admitted with decreased O2 levels. He's on 2 liters of nasal cannula. He's been tolerating that pretty well. His oxygen levels have been, low 90s, which is per the usual with COPD patients.
Yeah.
But he's been non-compliant at times, so you're gonna have to really keep an eye on him because I'll go in there and sometimes he'll have the oxygen on, sometimes he'll have it off. So.
Any reason for taking it off?
I don't know. I don't know if it's just because he's in the hospital and he doesn't like it, or I don't know. I'm wondering if there's some type of psychosocial issue. So I don't know.
Yeah.
But anyways, okay. So English second language. Did anybody tell you that?
No, I was not aware that was a thing.
Yeah, get ready. It's a lot of fun. So the translator will be in there. Well, hopefully she'll be in there. She was with me last night. So, but yeah, English second language. They can understand. His wife is bedside. She's really nice lady. God, she's so pretty. You should see. Oh my gosh, she is like. If I.
Okay.
Okay.
Let's stay on track.
Okay. Sorry. I'm sorry. I just.
Yeah, I believe you.
That?
Yeah, some patients. I swear.
I know. It's his wife. I mean, anyways. Okay, so. English. Yeah. Okay. So translator will be there. Yeah. And but they can understand English a little bit, but they just have a hard time.
Does she talk English?
A little bit, yeah. She speaks English, yes, yeah.
Okay, but he does not speak English.
Yeah, not that well.
Full time. Okay.
I mean, you can. I think I might hear them cursing in there a little bit, but obviously I don't know for sure.
Okay.
So he also has a chronic history of smoking.
That'll do it.
Like hardcore smoking. The wife told me something about Marlboro Reds, wants to be a cowboy. I don't really understand exactly how that ties in, but whatever. Yeah, Marlboro Reds, smoking heavy, 2 packs a day. Mm-hmm.
Ooh,
so we're talking heavy duty smoking. And he's a construction worker, so who knows what he's around.
All this is kind of tied in.
Yeah, exactly. Yeah. He wants to smoke. He's not happy. That's probably why he's taking out the oxygen. Now that I think about it, I mean, he wants to get outside and go smoke a cigarette. So the wife is having to tell him to calm down. The nurse is like trying. Doesn't know. I just didn't know what to do. So
we need some education.
Yeah, probably some education. And I'm just coming off night shift, so my patient was a little bit confused. So.
Okay.
Anyways, yeah. So he needs some maybe smoking cessation classes or education, something like that. But some type of alternative to education or alternative to smoking.
Okay.
But yeah, his lung sounds, when I did my assessment on him, he was maintaining his oxygen levels, like I said, low 90s on 2 liters of nasal cannula if he had it on. So there's that. His vital signs have been within normal limit. His blood pressure's been okay. And his lung sounds, he's bilateral wheezing. So, but that's about it. I mean, do you have any questions for me? Can you think of anything that you need to know?
No, I think we're good. I mean, if I have anything, I can always see if anyone else around knew anything was going down, but...
Yeah, Yeah, the charge
But it
nurse
looks
today.
like you covered it.
Yeah, and the charge nurse was here yesterday, and he, yeah, it was Johnny that was the charge nurse yesterday, right?
Yeah.
Yeah, he's back. I think he's back today, so he knows the patient and the family pretty well. So, let me know if you need anything.
Will do.
Okay, have a good day.
Thanks, you too.
Bye-bye.
Where's my damn lighter?
Damn it, Vinny! I told you, no cigarettes while you're in the hospital.
What am I
Shit.
supposed to do?
God bless it! I swear. Don't you know this is why you're here? You're here because of these. Smoking
Doesn't
a red,
matter.
you want to be a cowboy. I swear, I'm calling your nurse. Get her ass in here.
No, Doc. Hey guys, so your call light's on. What can I do for you?
I want to smoke a cigarette.
My husband wants to go smoke cigarettes.
Do you understand English? I'm gonna go get a translator, and I will come back to talk to you. That way, you can get the information that you're needing. Okay? So give me a couple minutes, real fast, and I'll be back with a translator.
Hello, Mr. Marcello. My name is Jenny. I'm going to be your translator today. And hello, Mrs. Marcello.
Hi.
How are you doing?
I'm good. How are you?
Not so great.
Why is that?
I want to smoke a cigarette. Can you tell the nurse?
Yeah, Mr. Marcello wants to smoke a cigarette.
Mr. Marcel, unfortunately, the hospital has a strict policy on no smoking around the area at all. It's hazardous to people around you. It's dangerous.
What am I supposed to do then?
Mr. Marcello said that. What is he supposed to do then?
We have alternatives that we can give you to help with the cravings, so like nicotine patches or gum. If you're interested, I can give you some education on those or give you one of those if it helps.
I don't want any nicotine patches. I just want a real cigarette.
Honey, come on, think about it, okay? You can't, I think the nicotine patches would do real good for you, okay? You're you're getting a little moody. I don't know what's wrong with you.
I just want a real
Are you
cigarette.
having a nick fit?
Just let me go outside and smoke a cigarette.
The patient really wants to smoke a cigarette.
Mr. Marcel, would you at least be willing to listen to some education and alternatives for it? Because I can't take you out to get a cigarette.
Fine, I'll listen to some education.
Mr. Marcello agrees to the alternatives and the education.
Perfect. Okay, I will go get some information for you, so that way I have everything that I can offer you, and then we'll get back and talk about it, okay? Alright, we're back with the education for you, okay? I think a good thing to start off with is letting you understand kind of what's going on inside your body. So let's talk about COPD so you kind of understand what's going on there, okay? So what's going on right now is that when you have COPD, the tubes that are kind of responsible for bringing oxygen into your lungs are being damaged, basically. They're completely damaged at this point, and it's compromising and making it harder for the oxygen to make its way in and out of your lungs and then make its way to your blood. So when you're not getting enough oxygen into your blood, it's having issues perfusing to other places, so like spreading around your body. So what happens is some of these things that are going on right now, you've got difficulty breathing, some tightness in your chest sometimes. You've experienced some of these symptoms before?
Yes.
Okay. Your heart starts to beat a little bit faster, and your mental alertness can start to fade because it's not getting the nutrients that it's needing that you would normally have with your normal respiration.
Well, I've been smoking for 25 years. Why is this just now affecting me?
Mr. Marcello said that he's been smoking for 25 years. Why is it affecting him now?
Okay, with COPD, it's called chronic obstructive pulmonary disease. It doesn't happen right away. It's over time. And so what's happening is you smoking over the past 25 years has just been a major buildup for this to happen and caused issues along the way.
So how are these alternatives going to help me?
He wants to know how the alternatives are going to benefit him.
So the alternatives are safer to begin with. Because you're on oxygen, you're at a high risk for like flame. And so whenever you're going to light a cigarette, you can cause some major risk factors there. So by giving you these alternatives like the nicotine patches, we have gum, we also have distraction methods we can teach you, or if you like to exercise and get moving, all of these are kind of help you with that craving that you might have, and it's a whole lot safer than trying to light a cigarette in the hospital when you have oxygen on you. How about I give you guys a little time to discuss it so that you can talk about it and see which one might help you. I will be right back. You guys go ahead and discuss your options and just let me know, okay?
Thanks.
Yep.
Thank you.
Vinny, I mean, come on. Think about it. Can't you just give these damn things up? I mean, honestly. What's the issue?
Why can't I just smoke it?
I know, but Vinny, don't you remember your cousin Giovanni? God rest his soul. Oh, God. Don't you remember what happened to him? I mean, he was smoking. Then he stopped smoking. He started exercising. He stopped smoking. He lost weight, exercised. He's doing great now. Don't you
He
remember
needed
that?
to lose the weight anyhow.
Vinny, I swear, you wouldn't hurt to put off a few pounds, too. I mean, hold your kid. Can you even hold your damn kid?
The only exercise I'm going to be getting is working at the construction site.
Oh, God. Vinny, if you live that long, you dumbass, don't you understand that? Keep this shit up and you're going to end up on a ventilator. You know what that is?
Yeah, I'm not going to end up on
Yeah, well,
vent.
guess what? I'm going to pull the plug on your ass. Think about it.
I mean, fine. If it makes you happy, I'll try.
Hi, guys.
Hi.
Have we thought about it at all? Like, made a decision on anything?
Yes, we talked about them. We did, didn't we, Vinny?
Yes, if it makes you happy, I will try the alternatives.
He's willing to try the alternatives.
Awesome. That's good to hear. Do you have a preference on which alternative you were thinking about trying to help you out here?
We were thinking about the nicotine patches and possibly the gum.
Okay, both of them. Got it?
Can we do both of them at the same time? I mean, he's got severe nick fits. I'm talking like bad.
I'll definitely have to look into the information on that and talk with your physician and let him know what's going on so he can give me a recommendation. And then I can get back to you on more information on that. But we're sure to get one of them going at least to help out with that craving, okay?
All right.
Did we want to try any of the other alternative methods to kind of help you cope with it at all?
Let's just start with the nicotine patches.
Okay, then yeah, I'll be back with those nicotine patches. Give me a sec.
Oh,
Hello.
how are you?
Good, how are you? Just want to check and see how the nicotine patch is working on you guys right now. I know it's been about maybe an hour or so since we put it on.
This thing's not working. I'm telling you, it's not working. I just want a cigarette.
He said it's not working. He still wants a cigarette.
I mean, we can possibly give you another one here soon and see if that helps you at all, or try some of the other methods, but for now that's about the best I can give you, because we just can't have you lighting the cigarette here.
I mean, once I get out of this damn hospital, I'm going to be smoking my cigarettes anyhow, so.
He said he's still gonna smoke cigarettes after he get out of here.
Okay, that's totally up to you. That is your decision. I just need you to know, I'm going to give you some information on that, that if you are smoking cigarettes when you're at home, and if you're off your O2, it's really important that you check your O2 stats. We'll let you know that too, so you can maybe be on him about it.
Okay.
Because if those drop at all, we need you back in here to make sure that you're getting the perfusion that you need. Okay?
Vinny, you gotta wear the oxygen, okay? You gotta wear it. If you're gonna smoke your cigarettes, you gotta take the oxygen off. And then you
Got
can
it.
smoke, okay?
I got it.
Okay. I'll get you some salami when you get home.